Your kidneys could be failing right now, and you would never know it. Over 37 million people have kidney disease, but 90% have no idea their kidneys are slowly shutting down. What if these 13 warning signs could save your life? Every single day, your kidneys work harder than you might imagine. These two bean-shaped organs, each about the size of your fist, filter 50 gallons of blood every 24 hours. That is like cleaning your entire bathtub more than 6 times daily. Your kidneys remove waste, balance fluids, and control blood pressure. But when they start to fail, they send warning signals that most people over 55 mistake for normal aging. The problem is, kidney disease is completely silent in its early stages. By the time most people feel truly sick, they have already lost 70 to 80% of their kidney function. At that point, the damage is often irreversible. But here is the hopeful news. When caught early, kidney disease can be slowed down significantly or even stopped completely. The key is recognizing these early warning signs that your body is desperately trying to send you. Have you been feeling more tired lately, even after a good night's sleep? Do your feet and ankles seem swollen for no clear reason? Are you waking up multiple times during the night to use the bathroom? These could be your kidneys crying out for help. What about that metallic taste in your mouth that just will not go away? And why do some people over 60 maintain perfect kidney health while others develop serious problems? Stay with me until the end, and I will share all 13 warning signs that could change everything about your health. Before we start, please subscribe to our channel and ring that notification bell. Tell us in the comments which part of the world you are watching from. Think of your kidneys as the body's master cleaning system. Just like the filter in your coffee maker, your kidneys have millions of tiny filters called nephrons. These nephrons work around the clock to clean your blood and remove toxins through your urine. Each kidney contains about 1 million of these microscopic filters. When these filters start getting damaged, they cannot do their job properly. Waste products that should leave your body begin building up in your blood instead. This buildup creates a domino effect throughout your entire body. Your heart has to work harder, your bones become weaker, your blood pressure rises, your energy drops. Scientists have discovered that kidney disease often develops alongside other common conditions that affect people over 55 thus, like diabetes and high blood pressure. The good news is that understanding these warning signs gives you the power to take action before permanent damage occurs. Research shows that people who catch kidney disease early and make the right changes can maintain good kidney function for many years, sometimes even for the rest of their lives. Now let me share the 13 warning signs that you should never ignore, especially if you are over 55. Warning sign number 1. Constant tiredness and weakness that rest does not fix. When your kidneys start failing, they produce less of a hormone called erythropoietin. Think of this hormone as your body's energy messenger. It tells your bone marrow to make red blood cells, which carry oxygen throughout your body. Without enough red blood cells, you develop anemia. This is not the same tiredness you feel after a busy day. This is a deep-toned, bone-weary exhaustion that makes simple tasks feel overwhelming. You might find yourself needing to sit down while doing dishes or feeling breathless after walking up a single flight of stairs. Studies show that 60% of people with chronic kidney disease develop anemia. Many people think this tiredness is just part of getting older, but it is often one of the first signs that something is wrong with your kidneys. Warning sign number 2. Swelling in your feet, ankles or legs that does not go away. Your kidneys are responsible for keeping the right balance of fluid in your body. When they cannot remove excess water properly, this fluid has nowhere to go except into your tissues. The swelling usually starts in your feet and ankles because gravity pulls the extra fluid downward. You might notice that your shoes feel tighter by the end of the day, or that your socks leave deep impressions on your legs. This swelling is different from the temporary puffiness you might get after sitting for a long time. Kidney-related swelling tends to be persistent and gets worse over time. Press your finger into the swollen area for a few seconds, then remove it. If your fingerprint stays visible for more than a few seconds, this could be a sign of fluid retention related to kidney problems. Warning sign number 3. Changes in your urination patterns that concern you. Your kidneys make urine, so when they are not working properly, you will notice changes in your bathroom habits. You might find yourself getting up multiple times during the night to urinate, a condition doctors call nocturia. Your urine might become foamy or bubbly, which happens when protein leaks through your damaged kidney filters. Healthy kidneys keep protein in your blood where it belongs. When you see persistent foam in your urine, especially if it looks like the foam on top of a cappuccino, this could mean protein is escaping through your kidneys. You might also notice changes in the color of your urine or feel like you need to urinate more or less frequently than usual. Some people develop a burning sensation when they urinate or feel like their bladder never completely empties. Warning sign number 4, shortness of breath that seems to come from nowhere. This happens for 2 main reasons when your kidneys are failing. First, the anemia we talked about earlier means your blood carries less oxygen, so you feel breathless more easily. Second, when your kidneys cannot remove excess fluid, some of that fluid can build up in your lungs. Think of it like trying to breathe through a wet sponge. You might notice you get winded doing activities that used to be easy for you, like making your bed or carrying groceries. Some people find they need to sleep propped up on extra pillows because they cannot breathe well when lying flat. This breathlessness often gets worse gradually over time, so you might not realize how much it has changed until someone points it out to you. Warning sign number 5, nausea and vomiting that happens regularly without an obvious cause. When your kidneys cannot filter waste properly, toxins build up in your blood. This condition is called uremia, which literally means urine in the blood. These toxins make you feel sick to your stomach in a way that is hard to describe to someone who has not experienced it. You might lose your appetite completely, or find that foods you used to enjoy now make you feel nauseated. Some people describe feeling queasy all the time, like having a mild case of food poisoning that never goes away. This nausea is often worse in the morning and might be accompanied by a general feeling of being unwell. Unlike stomach flu or food poisoning, this nausea does not get better with time or rest. Warning sign number 6, itching that feels like it is coming from inside your body. This is one of the most uncomfortable symptoms of kidney disease, and it affects up to 90% of people with advanced kidney problems. When your kidneys cannot properly balance minerals in your blood, substances like phosphorus build up to abnormal levels. This creates an internal itching sensation that no amount of scratching can relieve. People often describe it as feeling like they have bugs crawling under their skin, or like they need to scratch so deep they could reach their bones. This itching is typically worse at night and can make it extremely difficult to sleep. Regular moisturizers and anti-itch creams usually do not help because the problem is not with your skin itself, but with the chemical imbalance in your blood. Warning sign number 7, a persistent metallic taste in your mouth that affects your appetite. This happens because of uremia, the buildup of waste products in your blood that we mentioned earlier. These toxins can affect your sense of taste and smell, making food taste different or unpleasant. Many people describe the taste as metallic, like having a penny in your mouth, or bitter, like medicine. This can make eating feel like a chore instead of a pleasure. You might find that your favorite foods no longer taste good, or that everything has a strange aftertaste. Some people also notice their breath has an ammonia-like smell, which happens when waste products that should be removed by your kidneys are instead being eliminated through your lungs. Warning sign number 8, puffiness around your eyes, especially in the morning. This is often one of the earliest signs of kidney problems that people notice. When your kidneys cannot regulate fluid properly, excess water can collect in the delicate tissues around your eyes while you sleep. Unlike the under-eye bags that come with normal aging, kidney-related eye swelling affects both upper and lower eyelids and makes your eyes look smaller or more closed than usual. This puffiness is usually most noticeable when you first wake up and might improve somewhat as the day goes on and gravity helps the fluid move downward. However, as kidney function worsens, this eye swelling can become more persistent throughout the day. Warning sign number 9, high blood pressure that develops suddenly or becomes harder to control. Your kidneys play a crucial role in controlling blood pressure by managing the amount of fluid in your blood vessels and producing hormones that help regulate blood pressure. When kidney function declines, blood pressure often rises because your kidneys cannot properly balance sodium and fluids. This creates a dangerous cycle where high blood pressure further damages your kidneys, which then makes blood pressure even harder to control. If you have been managing normal blood pressure for years and suddenly find it creeping up, or if your blood pressure medications stop working as well as they used to, your kidneys might be sending you a warning signal. Warning sign number 10. Dry, itchy skin that no amount of moisturizer seems to help. Healthy kidneys help maintain the right balance of minerals and nutrients in your blood. When they are not working properly, this balance gets disrupted, affecting your skin health from the inside out. Your skin might become unusually dry and flaky, or develop a grayish color. Some people notice their skin feels tight or uncomfortable, like it is too small for their body. This is different from the normal dryness that comes with aging or cold weather. Kidney-related skin problems usually affect large areas of your body and do not improve much with regular skincare routines. Warning sign number 11. Unexpected loss of appetite and unintentional weight loss. The buildup of toxins in your blood can suppress your natural hunger signals, making food seem unappealing or even repulsive. You might find yourself forgetting to eat or eating much smaller portions than usual without trying to lose weight. This is not the same as losing weight through diet and exercise. This weight loss happens because your body is not getting the nutrition it needs, even if you are trying to eat normally. Some people also experience changes in their sense of smell that make food less appealing. Family members might notice you are losing weight before you realize it yourself, since the change often happens gradually. Warning sign number 12. Shortness of breath when bending forward, especially when tying your shoes. This specific symptom is called bendopnea, and it was first identified by researchers in 2014. It happens when fluid builds up in your lungs due to heart problems that can develop when your kidneys are not working properly. When you bend forward, this fluid shifts in a way that makes it even harder to breathe. You might notice this when putting on socks, tying shoes, or picking something up from the floor. This symptom affects about 1 in 3 people with advanced heart problems, which often develop alongside kidney disease. If you find yourself getting short of breath every time you lean over, this could be a sign that both your heart and kidneys need attention. Warning sign number 13. Cold hands and feet with possible blue fingernails or lips. When your kidneys are failing, your body works hard to protect your most vital organs by redirecting blood flow away from your extremities. This means less warm blood reaches your hands and feet, making them feel cold even in warm weather. You might notice your fingers and toes feel numb or tingly, or that they look paler than usual. In more advanced cases, your fingernails might develop a bluish tint, or your lips might look purple instead of their normal pink color. This happens because there is not enough oxygen-rich blood reaching these areas. Some people describe their hands and feet feeling like they belong to someone else, or like they are wearing invisible gloves and socks. If you recognize several of these warning signs in yourself or a loved one, here is what you need to do immediately. First, schedule an appointment with your doctor as soon as possible. Do not wait for your next routine checkup. Bring a written list of all the symptoms you have noticed, including when they started and how often they happen. This information will help your doctor understand the urgency of your situation. Second, ask for specific kidney function tests. The 2 most important tests are called a blood test for creatinine and a urine test for protein. These tests can detect kidney problems even before you feel sick. Third, bring a complete list of all medications, vitamins and supplements you take. Some common medications can damage your kidneys if used long-term, especially pain relievers like ibuprofen and naproxen. Fourth, be prepared to discuss your family history. Kidney disease can run in families, so your doctor needs to know if your parents, siblings, or grandparents had kidney problems. Fifth, start keeping a daily log of your symptoms, fluid intake, and urination patterns. This information can help your doctor track changes in your condition. Sixth, if you have diabetes or high blood pressure, make sure these conditions are well controlled. These are the 2 leading causes of kidney disease, but good management can prevent further kidney damage. However, certain people should be extra careful about kidney disease. If you have diabetes, high blood pressure, heart disease, or a family history of kidney problems, your risk is higher than average. People who have taken long-term pain medications, especially over-the-counter drugs like ibuprofen, are also at increased risk. If you are African American, Hispanic, or Native American, statistics show you are more likely to develop kidney disease. Age is also a factor, as kidney function naturally declines somewhat after age 60. If you have any of these risk factors and notice even a few of the warning signs we discussed, do not delay in seeing your doctor. On the other hand, if you have severe heart disease, liver disease, or other serious medical conditions, some kidney treatments might not be suitable for you. Always work with your healthcare team to find the best approach for your individual situation. Thank you for staying with us through this important information about kidney health. If this video helped you understand these warning signs better, please give it a thumbs up and share it with family and friends who might benefit from this knowledge. Your share could literally save someone's life by helping them recognize these symptoms early. Write in the comments if you have experienced any of these warning signs, or if you have questions about kidney health that we can address in future videos. You will notice that we have 2 videos on the screen now. I am sure you will enjoy continuing to watch more content like this that can help you take control of your health and live your best life. Remember, it is never too late to start taking better care of your kidneys, and small changes today can make a huge difference in your health tomorrow. Take care, and we will see you in the next video.